Since 1971, Fenway has made a difference in people's lives, person by person, story by story.
I was a teenager and had had some abdominal pain and was really having discomfort. I went to my regular doctor at the time. I had no health insurance, and as it turned out, I did have a bad pap smear, and it happened to be dysplasia. I could not afford to go forward with another treatment or some of what they recommended, so what I did was I was telling some friends, and I'll never forget it. One of my girlfriends just turned around and said, "Well, have you ever heard of the Fenway Community Health in Boston?" And I was like, "No, what's that?" Didn't even know it was there. So for me, it was really a light in the tunnel. So I got on the T, got to the Fenway, was seen by a wonderful doctor, and they did it for free. So I had access to good health care, treatment, and follow-up care after that. When I look back on my life over the last 50 years of what made a difference in terms of my well-being, the Fenway was key in that, and I feel that commitment strongly. I think that for the future generations, the legacy that the Fenway, or that I can impart by being part of that, certainly is important to me as a person, and also as leaving some sort of legacy in place for all of us today and in the future that may need good health care, good care, and a place to go to.
Fenway is a beacon in the community that serves so many. It welcomes everyone who goes through those doors. They don't discriminate. And even though we have a society that wants to discriminate, anybody who needs help, they're there to help out.
My name is Iris Rivera. I moved to Boston in 1987. And since that, after 6 months, I found out that I was positive. I asked my community what it was, and they didn't even talk about it. And they told me, this is a gay disease, and I said, but I'm not gay, you know, I have to do something. Fenway is a place where, since the beginning, they start to work with people with HIV. That means that they have a lot of experience. But they were very kind and very helpful. Without them, I wouldn't be here today.
It cares. It reaches out. It helps people who thought they had no help.
My name is Sam Abate, and I'm here to tell you how Fenway saved my life. About 6 years ago, I was a victim of a vicious and brutal hate crime. I was gay bashed. The guy tried to kill me. I was beaten with a 7-pound bronze candlestick so many times and so hard that the candlestick snapped in two. The experts said that if the candlestick hadn't broken and he'd continued to hit me, I definitely would have died. I lost 3 pints of blood, had a blown-out eye socket, and suffered multiple fractures of the cheekbone. I was rushed to the hospital where I received good medical attention and began my physical recovery. But that was only the start of my problems, and that's where the Fenway stepped in and saved my life. I was introduced to Dave Shannon and the Violence Recovery Program. Dave helped me to understand that it was not my fault that this happened and that I was the innocent victim of a terrible, violent hate crime. This may sound crazy, but after speaking with him, it was like I felt for the first time in my life that I was truly cared for. And, excuse me. And loved. I'm sorry, excuse me.
Fenway has always been there, responding to new challenges, growing, and making a difference in people's lives. Today, Fenway is a leader in healthcare, research, and advocacy. But we face a challenge. We've run out of space.
If you go into the present site, it's very cramped. Everybody's, working on top of each other.
To meet that challenge, Fenway is building a new home, a building that will meet the needs for today and allow for growth for tomorrow.
I look at this new center as a welcome wagon and a busy part of our city. I mean, just think of where it's going to be. On Boylston Street, in the Fenway part of Boston, a growing, thriving community with some of the best healthcare institutions in the world right around it.
A building that will allow our staff to work together for the first time in a decade. A building that will make people feel more welcome and better served.
The building enables Fenway to enhance the level at which it serves people by having more space and more settings and being able to carve out areas and places so people who are coming for a particular issue are getting a feeling of encompassing or warmth.
A building that will be the largest LGBT healthcare center in the world, dedicated to advancing practice, improving care, and saving lives.
We are very happy that the new headquarters for Fenway is going to be about 2 blocks from the main Beth Israel Deaconess campus. While we already have great collaboration, being within walking distance will make it even better. We hope to have meetings in both places and share facilities and the like, and I think that's really terrific.
A building that will make all of us proud.
I think it's going to be welcoming and open in terms of the way the layout is, the structure of the building. It's going to be larger, so everybody will have more room to work and do what they need to do to see more people. I think it is an enormous contribution to the community.
The 10 Stories campaign includes $7.5 million to help build this new building. $2.5 million is for endowment to maintain this facility, and $6 million in annual giving will support Fenway's day-to-day mission. But none of this will happen without you. Join us in this adventure. Join us in building these 10 stories and in telling the story of Fenway's future.
You know, the Fenway has 1,000 stories, not 10 stories, 1,000 stories, and they're all good stories. There's no bad stories when you talk about Fenway. That's when you talk about, you know, a place that really I look to, and I say I'm proud to be associated with it.